3, 2, 1. You are now live.
All right. Yes, and we are live. Okay. Hello, everybody. It's Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. We're here at Pure Plastic Surgery today, and this is the time we get to spend with you guys and answer all your plastic surgery questions, okay? But before that, I typically go into some plastic surgery topics, and today I want to remind you guys about the Avéli device, okay? So those of you who've been following me for a while know I've talked about this for a bit last year. This device came out pretty much last year in 2023, and what it is the only thing out there that actually works for cellulite removal or cellulite reduction, okay? Now, I know a lot of women suffer from cellulite because actually about 9 out of 10 women have cellulite, okay? And it's mostly a genetic thing. So it's not really about whether you're overweight or underweight or this or that. It's actually very much a genetic thing. So you can be super fit and still have cellulite. Of course, you can be overweight and have cellulite. You can be normal weight, lower weight. Anyone can have this, okay? And really, it's really not much that you can do about it, unfortunately, up until now. So there's always all these things that people say, you know, certain like creams and other, you know, injections and things like that, which are supposed to reduce the amount of cellulite. And guess what? Nothing really works because nothing got down to the actual problem or the root cause of the cellulite, okay? So what is the root cause? So why does cellulite happen? Well, cellulite is a dimple in the skin, right? And so what is causing that dimple? Well, turns out there's these bands right underneath the skin, okay? These fibrous septae that are actually pulling the skin down. So they're pulling the skin down right in that spot, okay? And that's what creates the dimple, all right? So it doesn't matter how many creams they try to sell you. If you put creams over top of the skin, it's going to do nothing for your cellulite, okay? So please, do not waste money and time on cellulite creams. They're not going to work, okay? You know what else is not going to work? Exercise. You know, if they say, oh, do a whole bunch of exercise, it's going to decrease your cellulite. Well, guess what? Exercise does not do anything for these bands. So the exercise is not going to work, really. So the only thing that's going to work is to address the actual problem, which is to release these bands. And that's where the Avéli comes in. So it's this device here. You can see it has a cool little light there at the end. And so what we do is that we have to make a little tiny puncture wound in the skin, which we do with a needle, like an 18-gauge needle. And then we're able to insert the device underneath the skin. We pass it to where the bands are. We then deploy a little blade. And then we cut all the bands. So that's the way it works. So you make a little nick in the skin, you place the device underneath the skin, you pass it through the area where the dimple is. That's where that little light comes in. So that's because with the light, you can see that light through the skin. So you can know exactly where you are. You can see that you're actually targeting the cellulite dimple that you want to target. And then you deploy this little knife here. Can you guys see that? Can you see that on the screen there?
Yeah.
You see that little knife right there? You deploy the little knife, okay, knife is now deployed, and then you pull back, and boom, you cut down all those septae, all those fibrous bands, you cut them, and therefore then, now here you see where they're all cut, they can be released, okay, now the skin pops up, so what used to be a dimple, now that skin can pop up and become nice and smooth again, all right? So that's the Avéli device. It's the only thing that actually works. We've been using it now for over 6 months, and we've had great success with it. It's worked really well, so I highly recommend it if you have cellulite that bothers you, of course. Like I said, 9 out of 10 women are going to have cellulite. Not everyone is bothered by the cellulite, which is fine. But if you have cellulite dimples, if you don't like the way that it looks in your leggings or your tight dress or your tight clothes, and you want to, you know, address that specifically, then this is a device to use. And the good news is that it can be done right in the clinic setting. It's not anything that needs to be done in the operating room, okay? You don't require any sort of like general anesthesia or even IV anesthesia. You don't require that. It's done right here in the clinic under local, meaning we just inject a little bit of local anesthesia, we numb up the area, and then we take care of all your cellulite. It's done in about an hour or two, depending on how much cellulite you have, and boom, you go home the same day. You can drive yourself in, drive yourself home, and there's really no downtime. You can go, you're back to work the next day, you're back to driving, you're back to pretty much everything except for maybe going to the beach in a bikini, right? Because you're gonna have some bruising from this. Eventually the swelling and the bruising will go down, and that's it. And the good news is that because you've actually cut all those bands, it basically cures that spot forever, for a lifetime. The cellulite in that specific spot is not gonna come back. Can it come back in other areas? Sure, but it's not gonna come back in the treated areas, okay? So again, now, the good news is right now, we're having a special for Avéli, okay? So, if there was ever a time you wanted to treat your cellulite, all right, give us a call right now. You can call us at 305-230-4326, or you can go to the website, www.pureplasticsurgery.com, and hit that virtual consultation button. And then when it asks you for your questionnaire and your photos, it's gonna ask you for the procedure, and choose Avéli, cellulite reduction, okay? Specials is going on right now, okay? It's not gonna last forever because it's becoming really, really popular, okay? So now's the time to call, all right? Now, I hope that's pretty easy to understand, but of course, I'll be happy to answer any questions regarding this or any question you have regarding plastic surgery. We're gonna kick it a little old school here today, so it's just a very short presentation, and now I'm happy to answer all your questions, okay?
Okay, this is for a couple that came late and they want to know if there's any downtime after the Avéli.
Yeah, so excellent question. So there is no real downtime, okay? So it's an in-clinic procedure. It takes about an hour or two, and you come in, you have it done, you go home, you can drive yourself, you go back to work the next day. Basically you can do whatever you want. We do recommend some compression sometimes, so sometimes you have to wear like a faja or something like that, but you're back to all your normal activities with minimal to no downtime.
Okay, this is about the bands. If they reconnect? How long to reconnect?
Yeah, so they don't reconnect. That's the great thing. So it's a one-time treatment, okay? So it's not like some of these other things they try to sell in the past where you gotta do like multiple treatments or multiple creams, blah, blah, blah. This is a one-time treatment. So that for that specific cellulite band that's being treated, okay, once these bands are cut, that's it. You don't have to treat that area again, okay? Now, is it gonna give you 100% relief? In some of them it will. Some of them it might be 80%. So what we've seen is anywhere from 80 to 100% relief of that cellulite dimple.
If you numb the area before cutting.
Yeah, of course. So that is step number one, but it's a local numbing, meaning we're not giving you anything IV, it's not general anesthesia. So we're gonna be numbing the area, okay? Once everything goes numb, then we can insert the device like I talked about through a little tiny stab incision. We go in, boom, cut all those bands.
Pain level?
Really the only part that causes discomfort is the actual numbing portion of it, right? Because we have to be able to insert that numbing medication in there, which is like a lidocaine. Have you ever been to the dentist? You know, sometimes they'll numb you up before they start working on you. So it's similar to that. But now, of course, we're not numbing the teeth. We're going to be numbing the buttock and upper thighs or hip areas.
Now, let's go to the questions. Instagram, does asthma disqualify anyone from getting surgery?
So the short answer is automatically no, right? If you have asthma and it's well controlled, that's the caveat there. If the asthma is well controlled, then it is okay to proceed with surgery, all right? So that means that you're taking your medications, and we typically ask you to bring your inhalers and whatnot, but if you have your asthma, it's well controlled, it's not a problem.
Okie dokie. ¿Se puede realizar, no vamos a Spanglish,
okay.
¿Se puede realizar lipo, tummy tuck, implantes de senos a la misma vez?
Se pueden realizar los implantes de senos y el tummy tuck a la misma vez. La lipo es una lipo limitada, ¿ok? So aquí en el estado de Florida, cuando estamos haciendo un tummy tuck, ¿ok? O cirugía en los senos, estamos limitados a cuánta grasa podemos remover por liposucción, que es 1 litro o 1000 cc's. ¿Ok? So se puede hacer algo de lipo, pero no una lipo completa 360.
Okay. Can you do Aveli the same day after getting a BBL?
Right, so that's a very good question and it does come up often. So, can you do the Aveli at the same time as your BBL? So, if you have, it depends on the degree of cellulite and how many lesions need to be treated. If you have moderate to severe cellulite, then then I don't recommend doing it at the same time. It's better to separate those things out. You can come in, have your BBL, and then about 3 months later have your cellulite treated with the Avéli device. Now, you have mild or mild to moderate cellulite, excuse me. So it's very kind of, few very distinct dimples. Then yes, it can be done at the same time. So really the best way to know is to get an evaluation, right? So go ahead and, to that website that we talked about, that virtual form, so that you can send in your photos and I can take a look and decide whether it's okay to do it all at the same time or whether we should space things out.
Okay, let's go to another question. Do you recommend losing fat weight before doing lipo? I want to get rid of back fat.
Yeah, so, to a certain degree, yes. First of all, remember, we do have BMI limits. So our top BMI is 30, or my top BMI is 30. So if you're above 30, you certainly will need to lose the weight, okay? Now, if you're planning on losing weight, like your goal is to lose whatever X amount of pounds, then it's also best to do that before the liposuction procedure, okay? Because if you do it after, say you have your liposuction procedure and you do it after, then you may end up with some like skin laxity or loose skin. All right. The other thing is to know about the skin, right? So it's better to lose the weight first, and then if you develop loose skin because of the weight loss, it's better to do your tummy tuck first, right? Guys, you guys should know this by now. All right, I always say tummy tuck first, tummy tuck first, tummy tuck first, okay? So if you lose a ton of weight, you have a lot of loose skin, then better do the tummy tuck first and then come back for your lipo 360 or BBL.
What do you think about using silicone tape on the tummy tuck incision instead of steri strips?
Well, you can do both, all right? So the initial thing that we put on there is your steri strips. The steri part of steri strips is that it's sterile, right? So we put on these sterile skin tapes on there. Those are typically on for the first 2 weeks. At 2 weeks, you can remove them. The incisions are sufficiently closed underneath there that then you can start using your silicone strips, okay? So steri strips first for about 2 weeks, and then your silicone strips.
My baby is due in August. How soon?
Okay.
How soon should I start planning and book my surgery?
All right, so baby is due in August. I'm not sure exactly what surgery it is, but if it's not a breast surgery, so meaning a body surgery, then you gotta wait at least 6 months. Okay, so 6 months after having the baby to have that type of surgery. All right. If you're having a breast surgery, you gotta wait 6 months from when you stop breastfeeding. So it's a little change there, right? So for body surgery, you gotta wait at least 6 months until after having the baby. And for breast surgery, you gotta wait 6 months until after you stop breastfeeding.
Can I get a tummy tuck even if I have a heart condition like tachycardia?
So that's gonna depend very, very much on the condition, exactly, okay? So tachycardia just means elevated heart rate, and some people have their heart rate which is a little bit higher than others, and if it's just what we call sinus tachycardia with no other underlying arrhythmias or other underlying conditions, then it may be possible. But what we're going to do in that case is that we're going to get some clearances. So we're going to get some clearances from your primary care doctor and from your cardiologist, okay? And they may ask for more tests. They may ask for an EKG, maybe an echo, maybe what they call a Holter monitor, whatever. So the point is we're going to ask for more clearances and more testing. And if everything pans out, and our anesthetists are okay with it, then we can move forward. However, if it's deemed to be too dangerous to be done in an office type surgery setting, which is what we have here, then we're not going to be able to do that surgery.
I want to do lipo in April. How soon should I do a consultation with doctor?
You're late. This April? Okay.
Hurry up.
Yes, let me tell you. I am almost fully booked for April. I'm actually not sure if I have I may have a couple spots left, but really not many. We're booking now actually into June. So if you want surgery in April, you go now, like right now. Go. You know where to go? You're gonna go to. Let me just write it down for you. Okay. Let's see here. So www.pureplasticsurgery.com. I'm sure y'all love my doctor's handwriting, right? Pureplasticsurgery.com, and you're gonna go to where it says virtual consultation. Okay? So you're gonna see a button that says virtual consultation, okay? You're gonna go there, you're gonna fill out the questionnaire, you're gonna send the photos, and if you're looking for April, you gotta go right now, okay?
Okay. Dog, I had a tummy tuck a year ago. It's keloid. I don't have a belly button. Can I fix it along with a tummy tuck scar?
And you say you don't have a belly button?
No, she doesn't have a belly button.
So there are some things that can be done. Of course, that would require an evaluation, but it is possible to do a scar revision in the area where you have the keloid. And it is possible to create what's called a neo-umbilicus. So we're basically creating a belly button. We're making something that looks very much like a belly button. Of course, you've lost your own belly button, so we have to create a new belly button, which is what a neo-umbilicus is. But it is a possibility, yes.
Do you recommend doing lipo first and then a breast reduction procedure?
Right, so those two, for the most part, you do have to separate them, right? Especially if you want a full-on lipo 360. But it can be done in either order, depending on what, I guess, is bothering you the most. You can do your breast first, and then 3 months later, your lipo 360, or you can do it the other way around. You can do your lipo 360 first, and then come back for your breast. 3 months, 3 to 4 months later.
Should I do BBL, then a tummy tuck in separate surgeries, or do them all together?
No, not all together, right? So for multiple reasons, I do not recommend doing your tummy tuck and your BBL at the same time, okay? What are they? First of all, what are we all about here at Pure Plastic Surgery? Is your safety, right? So if you combine those two procedures, the risks go up, the risk of complications goes up. All right, what are these possible complications? Well, one where it really goes up is the risk of potential for blood clots. So clots that can happen in the leg, those are called DVTs, or clots that can happen in the lungs, those are called a PE or pulmonary embolus, which can be extremely serious and may even be fatal. Okay, risk for infection goes up, risk for the skin dying, basically, we call skin necrosis. Risk for skin necrosis goes up, okay? Wounds being open, etc., etc. So all the risks go up when you combine those two procedures. Also, you're not going to get the best result from each of the procedures, because when you're doing a BBL, you shouldn't be on your buttock and hips. When you're doing a tummy tuck, of course, you got to be laying on your back. You can't be laying on your tummy. So you are going to compromise then the results from the BBL, because you're going to be putting some degree of pressure to the buttock and hips, even if you have those cutouts or special pillows or mattresses. Lastly, here in Florida, and this is not the same say in other countries or perhaps other states, but here in Florida, when you combine something like a tummy tuck and a BBL or lipo 360 procedure, you're limited as to how much fat you can remove. We can only remove 1,000 cc's, which is typically not enough really to make a big difference in terms of your lipo 360, and not enough in terms to make a big difference in terms of the fat that you're transferring to the hip and the buttock. All right, so like I just said there, like multiple reasons why I do not recommend combining a tummy tuck and BBL at the same time.
This is a message, not a question. I had
a message from TikTok?
From TikTok, yes.
All
I
right.
had a movie makeover with you 9 weeks ago,
Okay.
and I'm obsessed with my results.
Yes? Awesome. Thank you so much for being on here in the live, and thank you for letting us know. We look forward to your progress pictures, though. Make sure you send those to us.
Ya estoy convencida de que el doctor Earle será mi doctor para julio.
Julio, excelente. Qué bien, me alegro que ya tienen la fecha porque nos estamos llenando pronto, pero para julio estamos bien y bueno, como se dice, I look forward to seeing you en julio, que lo voy a ver en julio.
Is going to sleep dangerous? That's my main concern, not waking up. I'm so scared.
Yes.
I guess she's asking about anesthesia.
Yeah. So, a lot of people have that fear, so you're certainly not alone in that sense. So a lot of people have that fear regarding general anesthesia. I don't think it's founded. I think, general anesthesia can be very, very safe, of course, when it's done with the right people in the right hands and in the right facility, which we check all those boxes, right? Remember, our OR here is certified, it has the highest level of certification that an office-based surgery OR can have, which is the Joint Commission, or JCO. Our CRNAs are truly excellent. We have the same CRNAs who've been with us for over a year now, and they're great. I've had my own family members or my own staff members have surgery with them. And like I said, and it can be done extremely safe. The complication rates from general anesthesia are very low. So don't be afraid, okay? And actually, I think it makes certain surgeries safer. For example, like a lipo 360 or a BBL. Why is that? Because when you're doing an awake lipo or a BBL, you have to use a numbing medication called lidocaine. And if you use too much lidocaine because the patient keeps moving around or they're uncomfortable or whatnot, then you can have something called lidocaine toxicity. And that can affect your nervous system, i.e. seizures, or the heart, leading to heart attacks or arrhythmias. So very dangerous, okay? So I really don't like awake lipo 360 or BBL. I think the risk of the lidocaine toxicity is high. I think the patients are not comfortable. They feel it, they're not comfortable, they're moving around, so you can't really be getting that great result that you wanted to get because the patient's uncomfortable. So for all those reasons, I think doing these procedures under general anesthesia is the way to go.
Varias preguntas en español sobre cómo agendar la cita, cómo saber las fechas. So, en español.
En español,
Sí.
seguro.
Y que si habla español, pero como va a responder, ya sabemos que
claro que sí. So, aquí hablamos, aquí todo el mundo es bilingüe. O sea, que desde los cirujanos hasta el staff, la gente que va a estar contigo, las enfermeras, todo el mundo es bilingüe. Okay, so here we're all bilingual, we speak English and Spanish. Okay. Pero bueno, para las que hablan español, la manera de hacer la cita es que hay que ir al sitio web, okay, al website. El sitio web y es www.pureplasticsurgery.com, okay? Y ahí van a ver un botoncito que dice Virtual Consultation, que quiere decir consulta virtual.
Pero importante, ¿puedo?
Sí, seguro.
Que aprieten la banderita de español.
Y también se puede, también hay una banderita que si aprietas esa banderita se traduce toda la página, ¿ok? Y bueno, ahí cuando aprietas la consulta virtual vas a llegar a un lugar donde hay un cuestionario y vas a poder ver las fotos y escoger tu procedimiento, ¿ok? Llenas todo eso y después de que lo llenes, esa información nos va a llegar a nosotros y lo próximo que va a pasar es que una de nuestras coordinadoras las va a llamar y ahí van a poder coordinar todo lo necesario con ellas, ¿ok?
What's the lowest BMI for a BBL?
So typically it's about 21. Maybe there's some people who don't really want much, they just want a little bit in the hips or something like that with a BMI of 20 that you could potentially do. But usually the lowest BMI is about 21, and then of course my max BMI limit is 30.
There's any risk with going to sleep for a BBL on lipo?
Well, all surgeries carry risk, right? Any surgery carries risk. The only way to have zero risk is to not do surgery. In the same way, and the only way to have a 0% chance of crashing your car is to never drive, right? But of course, we're going to drive. So all surgery can carry risk, but the key is to try to get those risks to be as low as possible. And that's what we strive for here at Pure Plastic Surgery. That's why we're considered the safest clinic here in South Florida. Okay? Our risk of infection for BBL is extremely low. It's about 1%. I mean, it's almost unheard of for it to be that low. We have extremely low risk of infection. Our risk of fat embolism, which is what everyone's scared about with BBLs, okay, when the fat gets into the vessels, it's been 0. Okay, we've had 0 fat embolism, no deaths related to BBL, because I've been doing BBLs under ultrasound guidance since 2019. I've probably done the most in the US, over 2,000 ultrasound guided BBLs, and never had an issue with fat embolism. Okay? The general anesthesia, like I just talked about, very, very safe. We have excellent CRNAs. Our clinic is certified by the Joint Commission. So we have excellent results with our general anesthesia as well. So the bottom line is there 0 risk? Absolutely not. There's always a risk when you do surgery, always, okay? But the risks here are about as low as you can get.
Do you lipo the pubic area? Is it a higher risk for seromas?
It's not necessarily a higher risk for seroma, and yes, and yes, we can, if you want to lipo that area, we can certainly do it, and it is part of the lipo 360. That's right.
Yeah. We're almost getting to the end. When do you recommend to start using lipo foams?
So I recommend to start using it as soon as the day after surgery, okay? So now here at Pure, things have changed a little bit, but when you go home after your lipo 360 or your BBL, you're not going to be in your faja that first night. So everyone's staying out of the faja for the first night, and then the next day we're going to be doing your post-op call, and we're going to be looking at the skin. If the skin looks good and everything looks good, then you'll be able to then get into your faja and your foams, okay? But as soon as post-op day 1, so the day after surgery, you can have your first massage, your first shower, and get in your faja with your foams.
Okay, Doc, ready.
Okay, all right. Wait, no, that was 30 minutes already?
27 and counting. We have 3 minutes,
27.
but the questions are,
Okay.
for example, doctor, ¿usted habla español? Acaba de llegar otra vez.
Oh, seguro. Aquí hablamos español. Quiero dejarles saber que somos bilingües, no solo los cirujanos, pero todo el staff aquí en Pure Plastic Surgery. Okay?
Okay, we have 2 more questions just
Dale.
arrived. I bought iron supplements and sometimes forget to take them.
Yeah.
Will I still be good and have enough iron before surgery?
So, I mean, for the most part, you should be okay. But, you know, we do ask all of our patients to start vitamin C, folic acid, and iron supplementation at least 30 days before surgery, so we can build up those iron stores as much as we can before the procedure. Because we know what? We know there's going to be some degree of blood loss with the procedure, right? Especially for the bigger lipo cases like lipo 360, lipo 360 BBL. All right, so we want to build it up as much as we can. All right, and then during the surgery, of course, there's going to be some degree of blood loss. We're going to try to diminish that with using the cell saver, but we want to make sure you're fully optimized before the surgery. So do your best to not forget, right? And to take the supplements as best as you can. But overall, it should be all right.
Habla muy lindo español.
Okay.
Le dicen.
Excelente.
And somebody asked, that's Vaser cannula on your hand?
This is the Aveli, which is what we started the talk today. I erased some of it already, but this is a device that we use for that cellulite treatment. So it's the only cellulite treatment out there that actually works, because it goes to the root of the problem, like I just said. So it actually cuts the bands that create the dimples of the cellulite, okay? So that's what this is right here. That's the Aveli, and it's something that we use right here in the clinic. It doesn't necessarily have to be in the OR. It can be done under local right here in the clinic. And it can be done by my physician assistant, Natalie, and my nurse practitioner, Jenny, who are excellent at doing the cellulite treatment with the Aveli, okay? But if you're interested in Vaser, we do have a live on Vaser, right? So you can go to our YouTube channel at Pure Plastic Surgery on YouTube and check out my live on the Vaser, which I did one, I think, not too long ago, maybe a few weeks ago. And you can look that up and get all the information you need regarding Vaser.
I'm gonna like this comment.
Ajá.
Doctor, me dicen que usted es el mejor de la Florida. Tengo casi 20 años con implantes y con el único que me operaría sería con usted. inspira confianza.
Excelente, excelente. Y bueno, y si en algún momento estás lista, por favor, llena la consulta virtual, mándame las fotos y te podemos ayudar. ¿Ok? Alright, bueno, ahora sí. 30 minutes for sure. We're gonna slack on you. Excellent. So, if you all want me to talk about anything specific, please let me know. You can write to me in my DMs on Instagram or on TikTok, and we'll be happy to take up those subjects. Okay, but I look forward to seeing everyone next Wednesday. So next week on Hump Day with Dr. Alex Earle. Catch y'all later.